The coronavirus threatens many categories of people, whether because of individual risk factors or social barriers. That's the reason for a closer look at the risks for the LGBTQ community in a brief put together by the Fenway Institute. To tell us about it is the Institute's Director of Health Policy Research, Sean Cahill. Thank you very much for being with us, Sean.
Thank you, Chris. It's good to see you.
Sean, I don't automatically think of this whole community as being at higher risk, at least not uniformly, but give me an example of why you're concerned about higher risk.
Sure. Yeah, so the first point to make is that we have no information that LGBT people or people living with HIV are at higher risk for getting the coronavirus or the disease that it causes, COVID-19. But some people with HIV and some LGBT people could have a greater risk if they do get the coronavirus for complications if they get COVID-19, the disease caused by the coronavirus. And that's for a couple of reasons. One is, in our community, we see higher rates of certain risk behaviors that can put you at greater risk. This is a respiratory disease, and the fact that we see higher rates of smoking and vaping in the LGBT community. We also see higher rates of smoking among the population of people living with HIV. Probably we see higher rates of vaping too. I just don't know if data related to that. But since it's a respiratory disease, people who use tobacco or other substances may experience greater complications if they develop COVID-19. So that's one concern.
What about people living with HIV? How does that overlap with the coronavirus?
Yeah. So people who have chronic diseases and chronic conditions are at greater risk for complications if they contract COVID-19, if they contract the coronavirus and develop the disease. What's really important for people with HIV to know is that if you take your medications every day, if you are adhering to your treatment, you suppress the virus, you have a good CD4 count, and you take care of yourself in other ways. You eat well, you exercise, you get a good night's sleep. All those things can basically make it such that if you do get exposed to the coronavirus, if you do develop COVID-19 disease, you are less likely to develop complications. You know, so that's the most important thing. If you have HIV, make sure you have at least a month's supply of medication. Under the governor's emergency order, you have the right to get 60 or 90 days supply of medication. That's true of anyone with any kind of health condition, whether it's hypertension or whatever. So get the medication you need. Make sure you have enough, supplies in your house or your apartment, and just try to, ride it out to the best you can.
So you're based at the Fenway Health Center, of course, and
yes.
And you're familiar with the routine for people, whether it's living with HIV or some other issues. They have these routine visits. That's all disrupted now. What do you think that does to people?
Well, we're very concerned about social isolation. So Fenway Health has moved, by and large, to a telemedicine model for primary care visits, for behavioral health care visits. And so we're trying to provide the care to our patients to the extent possible virtually, because that lowers the risk to the patient, it lowers the risk to the healthcare provider, but it allows us to continue to provide care. So that's really, really key. And I would say social isolation is a concern, particularly with older adults who are LGBT. We knew that for a number of reasons. For example, many older gay men lost a lot of their friends to the HIV epidemic. Many long-term survivors living with HIV who can be gay men, they can also be straight women, straight men, bisexual, transgender people. Many of them lost a lot of their peers to the HIV epidemic. So we have higher rates of social isolation to begin with. We're also, even though many of us have kids and grandkids, we're less likely as a population to have children and grandchildren. Those are the built-in caregivers that most people rely on. And so we know that social isolation is exacerbated in this epidemic. So it's really important that we reach out to one another, check in on particularly older people, people with chronic health conditions, and make sure that they're doing okay. Make sure they have the mental health support as well as the physical health support that they need.
Of course, people can also be more at risk because of what they do for a living. And I think in your report, you mentioned people who work in the food sector. Why is that such a problem, you think?
One thing we pointed out in the report is that anecdotally, we know that a lot of people in the LGBT community work in food services. They wait tables. They work in the restaurant industry. Many work in the entertainment industry in New York and Los Angeles. So those sectors of the economy have been hit really hard by the economic shutdown that we're all experiencing. And so we already knew prior to the COVID-19 epidemic that we see higher rates of poverty among LGBT people, particularly lesbian and bisexual women and transgender women. And so for that reason, we're concerned about the economic impact on our community of what's going on. It's affecting everybody, but it could disproportionately be affecting a group that's already economically vulnerable. So that was one of the concerns we had. I do think that people who work in supermarkets, which is not necessarily disproportionately LGBT people, are also vulnerable. And I'm really grateful that people are working in food services to maintain food security for our society in the face of this epidemic.
I imagine a lot of these people in the food services sector might have limited eligibility for unemployment benefits.
Yeah, well, that's what we're hoping that our members of Congress and the federal government are addressing in this relief bill that's being debated right now and hopefully voted on today. It's absolutely critical that people get the temporary aid that they need to help get through this economic crisis. People have to pay rent, they have to pay mortgages, they have to, pay all the bills that we all deal with every month. And it's really critical that we help people out in this time of need.
One of the things I noticed in your brief is you pay attention to self-care. Why is it so important right now?
Yeah, it's really easy to get overwhelmed by what's happening. So we recommend that people take breaks from the news, they take breaks from social media, they try to remain hopeful, and they try to, people should get outside. It's a beautiful day today. Most of us are working from home. Take a break. Take a lunch break if you're working from home. Go outside and walk and just maintain a 6-foot distance from any neighbors that you might run into. And so those are some of the things we recommend. Don't let this overwhelm you. This is a time when we can read, we can watch Netflix. There's things that we can do. We can, those of us who have family partners that we're, living with, we can take care of one another. And we can do those things to support our mental health during this time of great stress.
I imagine too, I think this is a general kind of advice, but getting enough sleep, having a good diet, not going too far with alcohol consumption, for example, that can help the immune system.
Absolutely. That's the thing. You want to stay as healthy as you can right now in case you are exposed to the virus. That will help your body to fight back and it will help you to stay healthy. So getting enough sleep. And I know that a lot of people are very stressed out and that can affect people's sleep, but just try to take care of yourself and realize that this is, the last time we went through this, that humanity went through this, anything like this was 102 years ago. It's a very unusual circumstance, but we'll get through it together if we take care of ourselves and take care of one another and follow the guidance of public health officials who I think are trying to keep us safe.
Sean, in your briefs, you always consider the incarcerated population, the homeless population within the LGBT community. What kind of problems do you see for them right now?
Yeah. Well, we do know that among young people, we see higher rates of incarceration in the juvenile system, and we see high rates of youth homelessness. And it's quite possible that that continues over the life trajectory. So that among, middle-aged and older people, we see high rates of that too. Homeless people are extremely vulnerable right now. So we provide access to resources in our issue brief for people who are providing healthcare and services to homeless people. There's some online resources to help you understand what to do to minimize the risk that homeless people will contract the coronavirus. And then in terms of people who are incarcerated, we provide a link to a federal prison, Bureau of Prison plan to minimize the impact of coronavirus in the federal prison system. I trust that the state prison system here in Massachusetts is taking steps to minimize the risk for incarcerated people there and staff who are working in the prison system. But one thing that's been happening around the country is that there's been a push to get people who are nonviolent, non-dangerous offenders to be released to the extent possible to minimize their risk. Because when you're in a group setting like a prison, if there isn't the social distancing that's being encouraged, and if people are touching surfaces and sitting right next to each other in the dining halls, that's a recipe for disaster. So we want to try to minimize that kind of social mixing that we see in incarceration settings.
Finally, Shannon, we should mention that if people want to call for help or get some information, is there a way they can follow up with that at Fenway Health?
Yeah, so Fenway Health, our issue brief is on our website. It's an issue brief about COVID-19, LGBTQIA plus people, and people living with HIV. So if you Google that, you should be able to find it. We also have a COVID-19 information page, which we have a COVID-19 leadership team at Fenway Health, which is led by our medical director, Alex Gonzalez, and some other colleagues. And that provides links to information on the CDC website, on the Mass Department of Public Health website, Boston Public Health Commission. I would also encourage people to check out the CDC page. There's a lot of information there. They update it on a regular basis. And then the World Health Organization is another great resource. So I think there's a lot of good online resources, but stick to the advice of the public health professionals, the medical professionals, and like I said, try not to let this become overwhelming. Take breaks from paying attention to this and do things that can help you enjoy life, because we can still enjoy life as we hunker down and try to get through this.